Hello everyone, my name is Joseph Mayer. I'm submitting this video presentation for the Foundations of Gerontology online class at Old Dominion University for the 2014 fall semester. In this presentation I will discuss the highlights of my Assignment 1 and 2 papers. For my Assignment 1 paper, I focused on the nutrition program offered by the Older Americans Act. As we've learned from the Administration on Aging in 2006, the Older Americans Act is a law passed by Congress in 1965 that attempted to address the lack of public social services for older individuals. The legislation provides many services, although the purpose of the paper was to explore the effectiveness of nutritional services available to older individuals. Nutritional needs of older individuals consist of a balanced diet to live a happy, healthy life. According to Robnet and Chop in 2014, it may be difficult for older individuals to consume the required amount of calories due to changes in taste and smell. Decreases in taste and smell can create a decreased pleasure in eating that can lead to malnutrition or cause individuals to oversalt food and eat too many sweets that contributes to the development of diabetes, hypertension, and cardiovascular disease. The dietary guidelines for Americans in 2005 showed that older individuals should control caloric intake, eat a balanced diet, and moderate alcohol consumption. Older individuals generally require less daily caloric intake, therefore they should eat items from all food groups and that have high nutritional value. The Older Americans Act nutritional services can be found in Title II, III, and IV of the Older Americans Act. Grant and community programs provided by the Administration on Aging include services such as the nutritional education, nutrition counseling, home-delivered meals, multivitamin supplements, disease prevention, and nutritional research programs. After reviewing a wealth of information, there is no doubt that the Older Americans Act nutrition program is effective in providing funding for programs that improve the lives of older individuals. It was inspiring to see a program that was evaluated by Wellman et al. In 2008 that addressed a diet and exercise program funded by the Older Americans Act. The study provided evidence that funding provided to local and state agencies are able to motivate older individuals to increase physical activity and eat healthy. A study by Lee and Johnson in 2011 and a review by Sayoun and Vaden in 2014 also indicate that funding for home-delivered meal programs provide a major impact in food security of individuals. The home-delivered meal program is essential in providing older individuals with the nutrients needed to sustain life, whether used for supplement or solely supporting daily life. Many older individuals have retired from work and are on limited or fixed incomes. Thus, the home-delivered meal program is a means of providing older individuals the resources and nutrients needed to improve quality of life and decrease the risk of disease, frailty, and malnutrition. The Older Americans Act nutrition program is a wonderful program, but nothing is perfect. The inclusion of the multivitamin supplementation program with the Older Americans Act nutrition program is an example of this. An article by Mara and Wellman in 2008 indicated that multivitamins can work for some individuals, but may be insufficient and costly in the long run. Reasons multivitamins are ineffective are that most individuals will absorb nutrients from actual food better than vitamins. Multivitamins may contain nutrients that are already consumed in one's diet, and multivitamins may contain less nutrients than indicated due to poor manufacturing controls. Overall, though, home-delivered meals is the most prevalent and successful program offered with regard to nutrition, although there are other programs that are effective as well. For my Assignment 2 paper, I focused on the impact of the Affordable Care Act on Medicare and Medicaid. The Affordable Care Act, also known as Obamacare, was signed into law on March 23, 2010, and aimed to reform the American healthcare system. It attempts to do this by providing more American access to affordable health insurance, improve the quality of healthcare and health insurance, regulate the health insurance industry, and reduce the U.S. healthcare spending. There's been much political debate and controversy with the launch and implementation of the Affordable Care Act, although it provides Americans many benefits, rights, and protections with regard to health care. The Affordable Care Act improves Medicare and Medicaid coverage and allows for the expansion of Medicaid to 15.9 million individuals. Although the Affordable Care Act provides many beneficial solutions to improving health care, the legislation is still debated today, possibly due to the fact that it is a 10,535-page document that includes 109 regulations, as indicated by Starr in 2013. The elderly and underprivileged individuals will benefit greatly from the Affordable Care Act, while affordable aspect of the Affordable Care Act is questionable for other individuals. The Affordable Care Act is beginning to be implemented and enforced, but the future of the Affordable Care Act still remains uncertain. Medicare and Medicaid are both government-provided health care programs that supply medical and health-related services to different groups of people. Individuals can be eligible for enrollment in both. Both programs are managed by the Centers of Medicare and Medicaid Services, which is a division of the U.S. Department of Health and Human Services. Medicaid is a program for individuals and families with low incomes and few resources, while Medicare is a health insurance program for elderly and certain disabled Americans. Medicaid is controlled at the state level and Medicare is controlled at the federal level, but both are funded by the federal government through tax contributions. The eligibility for each program varies based on a wide range of factors, and both provide a variety of services, including hospital and preventative care. Although more services provided may be needed by individuals, in which individuals can obtain supplemental insurance to cover the gaps. After an extensive literature review, it was indicated that a merit of the Affordable Care Act is that it aims to fill gaps in coverage with regard to Medicare and Medicaid. With Medicare covering people 65 years and older, and some younger with disabilities, and Medicaid covering individuals of low income, which includes elders, the impact of the Affordable Care Act could be massive among older populations. Ways in which the Affordable Care Act improves Medicare are through financial and quality-based initiatives. In Thorpe and Filia in 2010, an initial sense of the improvements to Medicare and Medicaid were examined. It was indicated that the Affordable Care Act enables healthcare professionals to work closely together to provide a better all-inclusive care, which should improve the quality of care, adherence of prescriptions, and decrease out-of-pocket costs for older individuals. It was also indicated that Medicare benefits at the physician level, in which hospitals are paid more for better care, and physicians are able to promote the high level of care attained. According to Summers et al. In 2014, the Affordable Care Act also improves Medicaid through expansions. If states choose to participate in the Medicaid expansions, then a greater access can be felt and more individuals with health limitations can receive care. It also allows for individuals who were once uninsured to become insured based on low-income situations. It is important for elderly population who is mostly on a fixed income the later years of life. It was also indicated that the Affordable Care Act improved Medicare-Medicaid interface, where there is a strengthening of the Medicare-Medicaid boundary, increasing enrollment in individuals who were dual eligible, broadening patient long-term care options, and moving toward a team-based care. Hartman et al. In 2014 also indicated that all this has been taking place during a time when the growth of spending in both Medicare and Medicaid has slowed. If all of these advances are able to occur with decreased spending, more people should put the past behind and put political affiliations aside and start promoting the Affordable Care Act. I hope you enjoyed my presentation. Thank you and have a great day.